Welcome to healthU. Foamy urine lasting over 30 minutes? Doctors warn, your kidneys might be calling for help. Hello everyone. Today I want to discuss an important health warning that many people overlook: foam produced during urination. Have you ever noticed that sometimes your urine creates a lot of foam that persists for a long time? If you've experienced this, don't ignore it, because this could very well be a sign of proteinuria, and proteinuria is often an early warning of kidney disease. First, let's understand what proteinuria is. Under normal conditions, healthy adults should excrete less than 150 milligrams of protein in their urine over 24 hours. Our kidneys function like a precision filter, with the glomerular filtration membrane having three protective layers: the innermost endothelial cells, the middle basement membrane, and the outermost podocytes. This three-layer defense system typically prevents blood proteins from leaking into urine. When this filtration system malfunctions, proteins begin to leak into urine, creating what we call proteinuria. According to the 2024 American Society of Nephrology standards, proteinuria is classified into several levels. Microalbuminuria is 3,300 milligrams per 24 hours. Macroalbuminuria exceeds 300 milligrams, and if it reaches over 3,500 milligrams, it falls into the nephrotic syndrome range. So why does proteinuria cause foamy urine? This happens because proteins reduce the surface tension of urine, similar to adding detergent to water, making foam formation easier during urination. The key is that foam caused by proteinuria has several characteristics. First, the foam persists for a long time, usually over 30 minutes without dissipating. Second, the foam is fine and stable. Third, it may be accompanied by cloudy urine or abnormal coloration. However, don't panic immediately. Not all foamy urine indicates proteinuria. Several conditions can cause urine to foam: dehydration causing concentrated urine, urinating too rapidly, toilet cleaner residue, or even urinary tract infections causing pyuria. The key is observing the foam's characteristics and duration. Now let's discuss the diseases that proteinuria might indicate. Most concerning is diabetic nephropathy, the leading cause of chronic kidney disease globally. In Taiwan, approximately 45% of dialysis patients have diabetes-related kidney disease. Diabetic nephropathy initially presents as microalbuminuria, and early detection and control can significantly slow kidney function deterioration. Hypertensive nephropathy is another major cause. Long-term hypertension leads to renal arterial sclerosis, affecting kidney filtration. This condition usually accompanies hypertensive retinopathy, making fundus examination important. Besides these two common causes, there are primary kidney diseases like IgA nephropathy, the most common primary glomerulonephritis in Asia, membranous nephropathy, a common cause of adult nephrotic syndrome, and lupus nephritis, particularly affecting young women. How do we test for proteinuria? The simplest method is urine dipstick testing, though this has sensitivity of only about 300 milligrams per milliliter and may be affected by urine dilution. More accurate is the 24-hour urine collection test, the gold standard for proteinuria diagnosis that can accurately measure total protein quantity. However, 24-hour urine collection is cumbersome, so clinically we more commonly use random urine protein to creatinine ratio, UPCR. Normal values should be less than 200 milligrams per gram, and values exceeding 3,500 grams indicate nephrotic syndrome range. For early kidney disease detection, we also check albumin to creatinine ratio, UACR, an important marker for tracking diabetic nephropathy. If proteinuria is discovered, how is it treated? According to 2024 treatment guidelines, ACE inhibitors, ACI or angiotensin receptor blockers, ARB, are first-line medications for reducing proteinuria. These drugs not only lower blood pressure but can reduce proteinuria by 30 to 50% and delay chronic kidney disease progression. Recent years have brought emerging treatment options. SGLT2 inhibitors, originally diabetes medications, have been widely used for chronic kidney disease treatment since 2020 due to their significant cardiorenal protective effects, reducing kidney disease progression risk by about 30%. GLP-1 receptor agonists also provide multiple cardiorenal metabolic benefits. Of course, medication is only part of treatment. Lifestyle modifications are equally important. Regarding diet, for non-dialysis chronic kidney disease patients, protein intake should be controlled at 0.8 to 1.0 grams per kilogram body weight. Sodium intake should be limited to under 2.3 grams daily, equivalent to about 6 grams of salt. Potassium intake should be adjusted based on kidney function. Blood pressure control is crucial. For patients with proteinuria, blood pressure targets should be below 130/80 mmHg. We recommend regular home blood pressure monitoring, as it provides a more realistic reflection of blood pressure status. Prevention is better than treatment. Who needs special attention? Diabetes patients should check albumin to creatinine ratio at least twice yearly, keeping HbA1c below 7%. Hypertension patients need annual urine tests with blood pressure control rates exceeding 80%. Those with family history should start regular screening earlier. For generally healthy individuals, urine testing every 2 to 3 years is recommended. Diabetes or hypertension patients should test every 6 months. Those with detected microalbuminuria need quarterly follow-ups. Patients with macroalbuminuria require close monitoring every 1 to 2 months. Finally, it's crucial to emphasize that proteinuria is not only an indicator of kidney disease, but also an independent predictor of cardiovascular disease risk. According to 2024 research, even microalbuminuria increases cardiovascular disease risk by 1.5 to 2 times. Therefore, the concept "don't ignore foamy urine as it might be proteinuria" is vital for maintaining our overall health. Through early detection, appropriate treatment, and lifestyle modifications, most proteinuria patients can achieve good prognosis and maintain normal quality of life. Remember, our bodies communicate health status in various ways. Foam during urination is one important signal that shouldn't be ignored. Of course, this video only provides health education information and cannot replace professional medical advice. If you notice related symptoms, seek medical attention promptly and consult nephrologists or family medicine physicians for personalized diagnosis and treatment recommendations. Pay attention to your health, starting with observing small details. If this video helped you, remember to like and share. See you next time.